Ms. Cheng Li Hui.
Mr. Deputy Speaker, I stand in support of the Healthier SG White Paper. Sir, allowing our GPs to play a bigger role in our healthcare system is something close to my heart. In my budget speech 2016, I brought up coordinated care about GPs playing a more prominent role in the overall well-being of our people. 80% of our GPs are in private sector and only 20% of them are in polyclinics and hospitals, handling 80% of our population. I was told the ratio has improved since. I hope that with the focus on primary care, we can look forward to stronger GP-patient rapport. COVID-19 has shown us the importance of reducing our load on public healthcare institutions. Trust and rapport are implicit in healthcare. Often this trust overlaps generations and is passed between family members. This trust transcends doctor and patients and go into areas of digital privacy. In my 2016 speech, I mentioned I was surprised to see the GP in Australia pull out the X-ray and surgical records of the next patient from his computer. And it really made me ponder on the importance of coordinated care. The availability of our healthcare records will empower our GPs to make informed care decisions for us. We need to trust our doctors with the data and that the systems that hold our healthcare records are safe from bad actors, hackers, and lapses. In 2016, I also mentioned that isolation is one of the biggest problems for seniors. During the pandemic, due in part to the Seniors Go Digital program, many seniors learned to harness the power of technology and stay in touch with their loved ones. They were taught communication skills like video calls, connecting to Wi-Fi, and basic cybersecurity. This has helped many thousands of seniors remain connected and engaged through the most difficult times of the pandemic. We should continue with the momentum to enrich their lives for them to stay connected, not isolated, and yet not addicted. There's a small issue of addiction to gadgets, which may aggravate isolation. Some of you know I'm very close to my nephew. I'm also very conscious about children's gadget time. I'm even more concerned about my senior residents' gadget time. Many of them have learned to download movies and dramas and are hooked onto them. My volunteers and PA staff work hard to create programs to draw them out of their homes to have a healthy and active social life. Programs must be targeted at pre-retirement age so that they will continue their active social life post-retirement. For the not-so-socially active seniors, I was heartened to read ST article on 28th of September on retired timber worker Lim Tiam Ting, who warmed up to volunteers and is now an advocate of care centres. Sir, I've spoken several times in this house on our Tampines East 3-in-1 centre. The auntie who started walking to the centre before she went blind so she could familiarise herself with the route. Her meals were provided for in our centre and she could listen to the news in the afternoon amidst other activities. The auntie who no longer needed plaster after daily exercises at the centre. She also found someone there who loved singing Cantonese songs like her. Most recently, we had our youngest dementia patient in her early 50s. We could feel the increasing need for more senior care centres. I'm delighted to read that MOH has plans to increase these centres. This allows our elderly to age in place with their family and in familiar surroundings. I remember my first referral as a new MP. During our regular house visit, Auntie said that the flat is occupied by her and her husband who had suffered a stroke. For the past 7 years, she was his only and main caregiver. I asked her if she was okay and the tears just rolled. She said, "Okay, I'm tired. I cannot even go to the market for too long." Her eyes brightened up when I explained respite services at daycare centre. She was happy she could get a couple of days off to go and meet her friends and have a walk, just like she used to. I was reminded of the importance of care centre during pandemic when a resident approached me at the Tampines East Vaccination Centre. She said, "My brother-in-law is in your centre. He has dementia. It was so hard for us when the centre was closed. The day before opening, we told him. He seemed to understand and was in a good mood and went to bed readily. The centre is a great help to our family." Often, our mild dementia patients, or clients, will call me teacher and say they will go home and tell their parents about their day. I'm not sure if they remember too, but we go with the flow on good days and manage their bad days. I want to take the opportunity to thank all daycare and nursing home staff for for the contributions to the many family. It is not an easy job, it is a calling. Sir, I had mentioned senior daycare centres allow our elderly to age in place. Recently, a dementia client was supposed to be discharged from our centre. Her daughter cried when she picked her up on her last day at the centre. They were supposed to check into a nursing home that weekend as her condition has deteriorated. However, she was back on Monday. It was hard for some to send their loved ones to a nursing home. They will try and manage with some help from the government. With more understanding of how senior daycare centre works, the lower costs involved, I believe more families will be willing to have their loved ones in daycare rather than nursing homes, when they're still able to handle. We need to get our GPs to come on board to be a coordinator of care for these elderlies and the primary care networks under Healthier SG to play a bigger role in our elder centres. We can engage our neighbourhood doctors who know their clients well to educate or refer them to daycare facilities. Our Tampines GP, Dr. Leong, even contacted us when he had extra flu vaccines that had some months left to expiry, for us to ask our staff and clients if they would like to take the flu jab for free, and many did. So, while some families hire caregivers and have helpers to multitask with housework, children, and seniors, it lacks the exercise and activities elements that Senior Activity Centre or Daycare Centre provides. How can we further attract, train, support, and retain the staff of these centres to take on the expanded role by Healthier SG? Sir, in May 2016, the PAP Women's Wing made a trip to Hong Kong. One morning, we visited their senior daycare centre. I decided to spend the day there, and what struck me was the heart and effort the staff put in caring for the elderly there. For instance, one staff tried to feed an elderly using the spoon. She tried 3 times before she switched to tube feeding. She explained that she did that so that the elderly will still retain her ability to swallow and not just rely on tube feeding, which will aggravate her decline in her physical state. When the day ended, their families picked them up in a trolley sort of wheelchair as they could not sit up straight. Some thoughts went through my mind, such as, with this condition here, they will be in nursing home or with dedicated caregiver at home. Was it a lack of nursing home? What kind of training or qualifications are needed for some of the staff to manage clients with such chronic conditions? Will we see our daycare progressing to handle more chronic conditions? We will need a well-coordinated strategy that will take into account public health, sustainability, resilience, training, trust, and our aging population. Several of these topics are intertwined, and the white paper has done a good job in articulating these areas to address. Sir, I support the white paper.